Welcome to A Toast to Travelers.
Good morning.
Thank you so much for taking time to sit down and talk about mental health. I think the first thing I want you to do is introduce yourself, talk about your background, and just tell us a little bit more about what you do at Next Move.
Sure. So my name is John Heymach. I am the co-founder and chief clinical officer here at Next Move. I'm also a nurse. I've been a nurse for over 10 plus years in a variety of different units in the ER, telemetry, and primarily neurotrauma ICU.
Amazing. Okay. Can you talk a little bit more about what you do here at Next Move, specifically as it relates to like our clinicians and all of that?
Sure. So as a clinician myself, a lot of times I'll get calls from recruiters asking for help with a clinician that may be struggling on their assignment, may have questions that are clinically based, or just mental health issues that they're dealing with either outside of work, during work. And so I talk to them as an ear and listen about what their concerns are and see if we can come up with some support for them.
That's amazing. I love that we have that kind of resource. I feel like that's so important for them to have somebody that they can go to, especially while they're dealing with all of their mental health issues, like on assignment and things like that. So that's really cool. Can you talk to us a little bit about like what Next Move does to proactively aid, specifically as it relates to mental health for the clinicians who are working with us right now?
Yeah, that's a great question. So proactively Next Move is, clinician first, we're always there to help them. Proactively, we go and say to them, hey, we have these resources for you. When they sign our contracts, we reach out and say, if you ever have any problems, here's the resources where you go to find them. We have, whether you're insured or not insured, we have programs such as EAP that will help you with mental health, counseling, prevention, financial services, stuff like that, that a lot of times we don't know what our insurance can help you with. So we proactively tell them, hey, if you're running into any of these problems, here's where you go, and this is what we offer, so that if you ever run into a problem, we can help you. So
sure. Can you talk a little bit more about the EAP program?
Everyone's program is different, but there are free counseling up to a certain amount, depending on what the insurance allows. There are different financial services that we offer they can talk to. There are many different apps that they talk about. There's definitely mood stimulators and stuff that they provide, and just different resources around the area or nationwide if they're traveling, where they can find that help.
I love that we offer that too. Okay, so next topic, I do just want to like dive in, since you are heavily involved with our clinicians. If you could tell me a little bit more about like what types of issues they bring to you in regards to mental health. Like if you could talk about, there's a lot of similarities based off the situations that they talk to you about, or anything you can really share about that. Just so if someone's watching, maybe they can relate and they're going through the same thing. This might be like a good topic to discuss.
Yeah, mental health is a great subject to talk about, because I think the stigma of mental health has diminished over the years.
Sure.
And what the nurses are burnt out. They are some of the hardest working people you'll ever meet. And if someone ever tells you it's a 12-hour shift, it's not. It's always longer. The ratios have risen. The staffing has always been an issue. That's why we got into this, to help nurses and hospitals. And primarily what you see is nurse burnout, nurses getting assaulted at work, relationship issues where people don't understand what nurses do.
Yeah.
And just primarily what, even in like a neurotrauma ICU, what you see. A lot of nurses that face PTSD after seeing trauma over and over and over. That's what we see. And I think there's a lot of nurses that have alcohol, drug addiction problems, and they'll call and say, I need help. And that to me is great, because we can help these nurses find the resources and get them the help that they need.
Sure.
So I mean, the nurse burnout is the top one that we see a lot.
Sure. Yeah, I know that burnout is a big topic that is in the healthcare industry right now, and it's really sad, because I do feel like they're going through a lot just based off of all the situations that they encounter every day. When a clinician brings you a problem relating to mental health, what are the resources that you go to?
First and foremost, I want to make sure that they're safe.
Yeah.
they're in a safe place, that they're mentally safe or physically safe, or their family's safe. And listen, what is the problem? Let's find you the resources. What we do is I listen to find out what the situation is. Is this something, is it a legal issue? Is it a crisis issue? We've had emergencies at times where a nurse may not show up for work and the family's trying to get a hold of them. We have nurses that will call and say, hey, I need help. What we do is we make sure that we are the support for them, that we are the pillar and champion the help that they need. And we've had issues with suicide, and I know with the new 988 number, provide those resources. We have a lot of people that either are homesick or missing, and we just need to help them understand that we do have resources. And I think a lot of times people don't know where to turn. So when a clinician calls me and says, hey, I'm having this issue, we will do whatever we can in our power to help them, but not just help them and let them go, but to follow up to make sure that they're getting the help they need and check in on a regular basis, and with their permission, if they want us to call their family and let them know what's going on, we do that. And it's just not a transactional, it's really getting to know your clinicians and helping them.
I think that's so important. So you mentioned like the 988 number and all of that. If a clinician doesn't know where to go or where to find these resources, like what is the first step? Like if they don't know how to get in contact with you, like what do they do if they're struggling with this?
So we're currently adding all these resources on our website at nextmovehealthcare.com. And it's a great resource for people that may not even be a traveler with us.
Sure.
It's something that they can go to, they can find the resources, they can call their recruiter, you can call our main line here 24/7, and we will have someone help them be directed in the right area to find the help they need.
Awesome.
Yeah.
Okay, so last question.
Sure.
What can the general public or just literally the healthcare industry as a whole, what can they do to help with this mental health crisis right now?
That's a great question. I think mental health in the past used to be stigmatized a lot, that people are crazy, or that's just them. I think now that we're seeing more violence in this world that's related to mental health, I think that we all as a community need to come together and say, what resources can we provide and what money do we have that we can build up our mental health issues. Children's mental health, through COVID, there's a lot of different people that need help that A, don't know where to find the resources, or B, just don't want to talk about it. And I think as a community, if we can say, hey, it's okay, if you're having problems in your marriage, there's great therapists for that. If you're having a problem financially, it also takes the responsibility of the person to say, I need help.
Right.
The resources are there, but it works both ways. So I think the society, together, we can improve our mental health, because right now it's not working to the degree that it needs to be. And so we as a company can also strive to show these resources to people, and hopefully together as a community and a group, we can help everybody. So.
I love that. So, okay, if a clinician is struggling right now, they didn't know we had the resources, is there anything, like a last little thing that you would want to share with them to help them come forward?
I think a lot of nurses have hit rock bottom. I think a lot of people are afraid to ask for help. I will tell you that the people that we have helped have all come back and said thank you. I didn't know I was that depressed. I didn't know I had that much anxiety. The first step is always the hardest step, to admit that you need help. But people are not there to criticize you. They're there to help you.
Right.
And I think once people either go through therapy or get help with addiction, they truly realize that their life is worth it and that they have an opportunity to be the best person they can be.
Yeah.
So, call me,
Yeah.
call us, call anybody that we can provide the resources for, so that we can get, mental health and everything else working for people.
Sure. Well, thank you so
Sure,
much. I really
definitely.
appreciate you taking time every day to sit down and discuss this. I think it's so important, and I think it's going to be a great resource for our clinicians or just anyone struggling with mental health. So I
Indeed.
appreciate it.
Thank you.